for joining us for this situational update on the community spread of COVID-19. I just want to start by saying, when we sunset the weekly COVID-19 briefings in March, we made sure to note that at the end of those briefings did not mean that the pandemic was over, and that the city and the county would continue to work to update the public as changes in the pandemic landscape took place. And so this week, our region moved into the yellow or medium category of community level spread per the CDC's metrics. And so today, we have the Milwaukee County Chief Health Policy Advisor, Dr. Ben Weston, and the City of Milwaukee Health Commissioner Kirsten Johnson to explain what that means for our region and remind residents of the tools and best practices available to keep themselves safe. And so before I turn it over to those speakers, I will let you know that, yes, there will be some changes to Milwaukee County's masking requirements at county facilities. I can take those questions offline since there is some nuance to those changes, considering the varied levels of risk in different county facilities, and the fact that these changes mainly affect county employees more so than members of the public. So I will put my cell phone and email in the chat, and folks can ping me if they like information on what those changes look like. But we want to be able to keep our focus today on what this means for the public, what this means for our region, and what some of those best practices and recommended tools are that people can use to keep themselves safe and keep themselves healthy. And so lastly, I want to remind folks that, we don't have a crystal ball. We can't predict the future here on the uncertain pandemic landscape, but we do know that right now there is an opportunity to take these rising cases as a opportunity to remind folks to stay vigilant when guarding themselves against the disease. And so with that, I will also ask that you put any questions you have in the chat. Please indicate if that question is for Dr. Weston or for Commissioner Johnson or for both. And so with that, I'll turn it over to Dr. Weston now to get things started.
All right, thank you, Brandon. Good morning, everyone. Yesterday evening, the CDC COVID-19 community level data was updated, indicating that Milwaukee County entered the medium or yellow category. Now, since early March, we've been consistently and solidly in the low or green category. And this change to yellow is in response to an increase in case rates from 158 cases per 100,000 people last week to 206 cases per 100,000 people this week. That's a 30% increase in 1 week. Now, going over that 200 case rate mark during a 7-day span brings us up to the medium category of community level transmission. And as much as we all want to be done with COVID, we should take this moment as an opportunity to remember that we're still dealing with COVID-19, and members of the public should remain cautious and remember to take measures to keep themselves safe. Now, the best protection tool we have available are the life-saving vaccines and boosters. And staying up to date on these series of shots is critical. Now, as the CDC outlines, those at higher risk or around others at higher risk should mask when indoors. And when you mask, it should ideally be a high quality mask, such as a KN95 or an N95. Now, around others is a key part of that sentence. Protection and caution during this pandemic has been about the individual, but perhaps more importantly, it's about the community. It's about compassion and empathy and altruism. When you go to the grocery store or to the mall, to the pharmacy, it's important to remember that thousands of immunocompromised folks live in our community, and thousands of higher risk individuals in older age groups, and many children that remain unvaccinated or unable to get vaccinated yet. Now, as has been the case each and every day throughout the last 2+ years, we're all in this together. So please remain cautious with layers of protection and assessing your level of risk. And continue to test if you've had an exposure or experiencing symptoms. And if positive, consider treatment with the antiviral medications now available. We're certainly hopeful that this increase in cases will be short-lived, and that the increases we're also seeing in hospitalizations will remain relatively minor. But as we've seen over and over with this virus, we cannot predict the future. But we can use the knowledge that we've gained over the past 2 years and the tools currently at our disposal to keep ourselves and our community healthy. Thank you and stay safe, and I'll pass it to Commissioner Johnson.
Thank you, Dr. Weston. The burden rate in Milwaukee has increased over the past 3 weeks. While our numbers remind us that this virus is not done, it's not cause for panic. Although increasing, our hospitalization numbers remain fairly low. This may indicate that many people who have the virus right now are experiencing more mild symptoms, and we can likely attribute this to the effectiveness of the vaccine. Data has shown being up to date with your COVID-19 vaccine, meaning fully vaccinated and boosted when eligible, decreases your risk for severe illness, hospitalization, and death. However, while some people experience mild symptoms, many Milwaukeeans are still at risk for more severe illness, including those who are immunocompromised, ineligible to be vaccinated, or over 65 years old. Now is the time for us as a community to step up to protect our friends, family, neighbors, and loved ones. We've learned a lot over the last 2 years. This virus is dynamic and unpredictable. It doesn't care about city, county, or state boundaries. And because it's contagious, our behavior affects everyone around us. However, we have developed effective tools to protect our health and the health of others, and we must continue to implement those tools, especially when cases increase. First, and most importantly, as I said previously, it's imperative to get vaccinated and boosted when you're eligible. Over 11 billion doses of the COVID-19 vaccine have been administered worldwide, and studies continue to be conducted to understand how well the vaccines work in the real world. These studies show that vaccines are effective at preventing severe illness, hospitalization, and death. And adding a booster dose or second booster when you're eligible further increases your protection. The vaccine is safe and the most effective tool we have. So please, if you've not yet received your COVID vaccine, make it a priority. The Health Department COVID-19 sites operate 6 days a week and have free vaccines available with no appointment necessary. The hours of operation can be found at milwaukee.gov/COVIDvax. In addition to vaccine, wearing a mask, especially a well-fitting N95 or KN95 that snugly covers your nose and mouth, is strongly recommended as best practice in public indoor spaces. When you're in public spaces, you do not know the circumstances of the people around you. They may be caring for a sick relative. They may be protecting a child under the age of 5 who cannot get vaccinated. They themselves may be immunocompromised. Wearing a mask protects you, protects those around you, and signals you care about the safety and well-being of others. As the weather in Milwaukee finally begins to warm up, we hope, it's time to open your windows and take activities outdoors. Research shows changing the air in a room multiple times per hour with filtered or clean outdoor air can reduce the risk of COVID-19 transmission by up to 50%. If you're planning to visit family this weekend for Mother's Day, consider gathering outside or in a well-ventilated space. Testing before you gather is another great tool to ensure you're not putting anyone in harm's way. Rapid at-home tests are readily available, and Milwaukee Health Department COVID-19 sites have free PCR tests available Monday through Saturday without an appointment. Stay home when you're feeling sick, avoid large indoor gatherings, and wash your hands often to reduce the spread of the virus. We have the tools and need to use them. Thank you.
Thank you, Commissioner. So I'm seeing a few questions in the chat, and I will go ahead and start with the question posed to Dr. Weston from WISN 12. They ask, do you have any specific numbers for the COVID hospitalizations in Milwaukee County? And is there a common thread amongst those hospitalized?
So right now, we have 72 people currently hospitalized with COVID in the county, and that's doubled over the last 2 weeks. We don't have data currently on the vaccination status of those in the hospital right now, but really without a doubt, as we've seen throughout the pandemic, since vaccinations became available, you're far more likely to be hospitalized if you're not vaccinated. And the booster provides critical added protection against severe disease, as well as hospitalization and death.
Thank you. Next question from the same outlet. This is for the commissioner. You said that going to yellow should not induce panic. Why do you say that?
Good question. I say that because, again, as I mentioned, there are a lot of tools we can do to protect ourselves. We can be vaccinated, we can wear masks, we can meet outdoors. So again, summer and spring is working in our advantage if it ever gets here. But we have tools that we can use to protect ourselves, and we should, and testing, and we should really, I encourage people to use them. We've learned a lot.
Thank you. Next question is from Mary Jo Ola at TMJ4. This question is for both of you. What are your thoughts on the Johnson & Johnson vaccine? Should people stop getting them? And then the second question is, will the city or county issue a mask advisory or mandate?
I'll take the first part. So as far as the Johnson & Johnson vaccine, we've talked about in the past that this vaccine has an extremely low rate, but a real rate of inducing a rare type of blood clot. I think what this shows is two things. One is that the FDA and the CDC are taking this very seriously, and they're watching these vaccines very closely to make sure there's no adverse events. I think the other thing it shows us is just how incredibly safe these vaccines are altogether. A couple people out of a million getting blood clots is far lower as far as rate of side effect than most other medications you have in your medicine cabinet. But the fact that we have 3 vaccines available in the United States and that we would recommend against one because of these sort of side effects points to just how safe the Moderna and the Pfizer vaccine are. There's pretty close to 0 true concerning side effects from these vaccines. They're incredibly safe. And as we've seen, they're effective as well.
Thank you. Commissioner, anything to add there?
No, I don't have anything to add. Thank you.
Excellent. The next question is from Kim Shine at CBS 58. Could these numbers be higher given the in-home testing available? I guess that's a question for either one of you.
I can start and Dr. Weston can jump in. I think what's interesting and most important for us to take away from these numbers is the trajectory. We've certainly seen an increase in the number of cases. I think that's what the message really is. The cases are increasing. As such, we should take precautions. They are less accurate than they certainly were previously or earlier in the pandemic because people are using home testing. But home testing is a great tool to protect yourself and those around you because you know if you're going to go, for example, to the Bucks game tomorrow night, if you test yourself before you go and you're negative, you know that you're safe being in that space. You are, however, relying on those around you to not spread it to you. But again, I think what's important for us to look at this point in time is the trajectory, and cases are certainly increasing. So it's time to be cautious.
I agree completely. I mean, there's no doubt that our case numbers are far higher than what we're seeing reflected here. If we had been a time previous when we didn't have the rapid antigen test as readily available, I think we'd be seeing far higher case numbers. And even then, we knew we were missing lots of people who just weren't getting tested. But as the commissioner said, the trends are what is key. And we're seeing very clear trends across the board, whatever measure you look at. Cases, positivity, we're at over 10% positivity right now. We haven't been over 10% positivity in 3 months. If you look at hospitalizations, we're starting to see an uptick. If you look at wastewater, we're seeing increases. So across the board, the trends are very clear. But as the commissioner also mentioned, that trade-off of understanding the exact number of cases is worth it because so many more people have rapid access to home antigen tests that they can do themselves. And 15 minutes later, they have a pretty reliable test to tell them whether at that moment they may be contagious with COVID.
Thank you both. Next question is from Mary Jo Ola at TMJ4. And I just lost the question, bear with me. What should people who have had prior COVID infection know about where we are in the pandemic and how should they behave?
Well, so as we've seen throughout, prior infection with COVID does provide some level of immunity. The 2 concerns with that immunity, one is it's unclear how strong and how durable and long-lasting that immunity is. We're seeing, for example, these new variants out of South Africa, BA4 and BA5, don't seem to much care if you've had COVID in the past. They are, however, responsive to the vaccine. The other concern with infection-induced immunity is it's not a very safe way to get immunity. You run the chance of having severe infection. You run the chance of getting long-term symptoms, long-term symptoms from COVID. And so the vaccine is a reliable, dependable, and extremely safe way to get that immunity and prevent yourself from getting not just sick with COVID, not just transmitting to others, but getting severe disease and getting hospitalized.
Thank you. Next question is from WISN to Commissioner Johnson. Do you feel that the city is in a different place as COVID cases rise this time as compared to previous spikes? Why or why not?
I certainly do think we're at a different place. To start, we have a vaccine that we know is effective at preventing severe illness and death. The number of cases we're experiencing right now pales in comparison to what we experienced this winter in December and January. So even if you look at the wastewater data, you can see a significant increase in the wastewater data that we're not currently seeing. We're seeing a small sort of increase. So I do think we're in a different place. The other piece that's interesting is that it's getting more challenging to compare ourselves to other countries because there are so many other factors that have been introduced. So different types of vaccine, different levels of vaccination status, so fully vaccinated versus boosters, versus a booster versus 2 boosters. So we are certainly in a different place. But again, I think what's most important is we're seeing an increase in the trajectory, and it's time to be more cautious.
Thank you. And the last question I'm seeing in the chat here is from Kim Shine at CBS 58. Is there any chance that vaccine pop-ups at Bucks games and other community places that happens again either now or later in the year?
That's a really good question. So yes, we are currently really targeting our vaccine efforts on neighborhoods that we know have lower vaccination rates, but also on long-term care facilities. So we know people who are most impacted, most critically ill, are people who are older and who may not have gotten a booster. So our current efforts are really trying to increase the booster uptake in our most vulnerable population in the city. We plan to work very heavily this summer at many community events, including pop-ups. And we also are anticipating when vaccines available for children. So we will be working closely with MPS. And then finally, we continue to be in the vaccine space at our 3 sites throughout the city, so Northwest, South Side, and at a Menominee Valley drive-through site, and anticipate that we will do that through the course of the summer and into the fall.
Another question just popped up in the chat from Mary Jo Ola, TMJ4. What are you hearing about vaccines for kids under 5? Could they come soon?
Sure. I'll start, and Dr. Weston, you can chime in afterwards. But the most recent update was that it's going to be reviewed on June 8th at the FDA. And I would anticipate that we'll get more information within a week or 2 from there. So hopefully by mid-June, we'll have vaccine for children under the age of 5.
Any other questions for our speakers today? All right. Well, if there's no further questions, again, I just want to remind folks that I put my contact information in the chat, so you can feel free to reach out to me to get some of that information about the county masking requirement changes at county facilities for county employees, contractors, and volunteers. Thanks so much for joining us this morning for this update, and we hope that we can continue to be as informative and responsive in the future. So thanks so much. Have a good day, everyone.
Thank you.
Thank you, everyone.